Hey, so you guys got a CPAP and you don't know how to use it. Well, I'm going to show you how to set it up start to finish. This is for ResMed AirSense 10. You guys should get it already set to your pressures that were prescribed by your physician. We have to set it per those prescriptions. And I'll explain a little bit about that kind of as I go through it. So, if you're wanting to know how to use a CPAP, here you go. Okay, so when you get your CPAP, it's going to come in a little travel case like this. A little handle, a little zipper pouch on top. I'm trying to do all this one-handed, so bear with me. Open it up. You got all your books. The machine. You have there's pictures that shows you where everything goes. So your hose for the machine goes right up here. This little zipper pouch. So there's your hose. We'll open that up here. Here's your machine. So there's the picture of the machine, shows you where it goes. So there's your machine. The humidifier, which is this, well, this is the humidifier chamber. Your actual humidifier is built in. So it's that right there. That plate's your humidifier. This is the chamber that you're going to fill with distilled water. You're going to fill it to the max line there. You just kind of top it off each day. As long as you're using distilled water, you have to use distilled water. And you'll just kind of eyeball that. And, you know, if it drops down a little bit, just top it off, fill it up on a daily basis. And then once a week, you'll clean it out. Just some baby shampoo or vinegar and water is really good to clean with. 1 part vinegar, 10 parts water. But a lot of people just use baby shampoo, and they'll pop this open and rinse it out, let it dry, and start all over. And it fits right in like that, like you shove it all the way in there. I'll show you guys in a minute. Power supply right there. So here's your power. It's like a little laptop. Get it out of there. So power, you got another cord in here that one end plugs into the power. The other end goes to the wall. And then this end goes into the back of the machine right there. And you really got to push that in. You just push it in there, get it in there pretty tight, and it'll all power on. So I'm going to go ahead and hook all this up and show you, give me 1 second. Okay, so I wanted to open up this, your hose here so I can show you. You got 2 different looking ends on the hose. One end has a little chip on it there. The other end does not. So this end with the chip is going to plug in to the back of the machine. You just kind of line it up. Actually, let's see if I can do this. Ooh. Line it up, snap it in, pop it in there, and you can rotate it, you know, whichever way you want. To get it off of there, you actually pinch. Both sides has this little squeeze on it, both sides there. So you just pinch it and pull it right off. So that's how you get your hose on and off of your CPAP machine, like that. So I'm going to go ahead and plug in the power and show you guys some more. Okay, so it's all plugged in. Got the water chamber here. Actually, this is just a demo we have, but there's the other one. So the water chamber, like I said, this side, you just pop it open. You kind of pull out, and it'll pop open like that. That's how you fill it. Put your water in there, fill it to the max line, right there. There, focus. Just kind of eyeball it. Top it off as needed. And yeah, wash it out once a week or daily. Some people say daily, but once a week you're good. Snap it shut, and this is going to go right in the side like so. And then to get it out of there, you have to squeeze down top and bottom. So see how it kind of releases there? Then you can pull it out and pop it back in. So if you're trying to pull it out like that, it's not going to come. You have to squeeze it down, pull it out. All right, so on the machine itself, you got this is your home screen. It says My Options and Sleep Report. So what this machine will do is each night when you're sleeping, it will, if you can roll that to highlight the boxes. It's kind of going in and out of focus there, but highlight sleep report, you roll it, and then you click it. Now you're in your sleep report. This will tell you, actually I didn't set this up properly. Hang on one second. Okay, let's try that again. So there's a setting in here. So if you scroll down to sleep report, you scroll sleep report, click your button. So now you're going to have this little option in here that says, well, to start off with, this is going to record how long you wore this machine last night when you slept. And it'll tell you right here you wore it for, 6 hours and 38 minutes or whatever. Events per hour. So this is basically, your doctor should go over all this with you based on your sleep study. I'm not a sleep tech, but I've done respiratory for 30 years and CPAPs for 12. So basically this will tell you in a nutshell, like how many times you stop breathing per hour, average that last night. So this could say 5.0, which 5 events per, that means 5 events per hour. That's completely normal. Like everybody has 5 events per hour. It's not, you're not diagnosed with sleep apnea until you get 6 events or more. And actually it's, anywhere from 6 to I think it's 15. Again, they can diagnose you with sleep apnea, but you have to have some other underlying conditions to go along with that. If you're over 15 events per hour, like if you're up at 20 events per hour or something like that, no question, you got sleep apnea. So they'll probably snap you on one of these machines. But anyway, this will tell you, hey, you're wearing this thing. Last night you slept for, 6 hours and 34 minutes, and you had 3.2 events per hour average. That's good. That's normal. So anything below 5, completely normal. This just shows that you had a happy mask. Your mask sealed very well last night, which I don't care what any therapist tells you. You're going to get a perfect fit when you're in here getting set up with these things. But when you start wearing them, yeah, you're going to get leaks. You roll around at night. It's not comfortable. You wear these things. I mean, you haven't done this, so you got to get used to it. You may end up with some frowny faces, which means you got a pretty big leak that you need to address with your mask. And I'll go over the mask and stuff in a little bit. But anyway, this, happy face, yeah, that's good. You can dial this down. See how that blue bar moves down as you turn this? See, if you go down, now this just means your humidifier, everything's working properly. There's a lot of other info in here. This is done on a monthly, so this is giving you averages throughout your month as you've worn it for a month. You can actually change that time period. See how the bar now goes all the way across? If it's lit up like that, you can click it to go into another menu to where you can change this to, all I want to see is my daily report. And again, we're talking about all this lower data that we went to. Daily, I'd just leave it on a month. I mean, you can change it if you want, but usually monthly is what people are looking at because that gives you a good average. So your average days used this month, that's what that's going to tell you. Your average days that you used it greater than 4 hours, because that's the goal. Most insurances are going to require you to wear this for greater than 4 hours per night in order to meet their compliance. So this is a good number to look at, your days above 4 hours, you know, say you wore it 22 out of 25 days, greater than 4 hours, that's awesome. You're doing good. Scroll down, average usage. That just tells you how many hours average you've used it per night over that 1 month period. Used hours, that's how many hours you've actually used it through the whole 1 month period. Pressure, back here. So we're using an auto CPAP right now. What this is, I'll actually get into the pressures later. I'll talk about that in a bit. But your pressure here, that is telling you what your average pressure is for the month that you've been using. Leak, I believe you're going to get the red frown face. I think it's at 25 liters per minute of a leak. But honestly, I mean, if you're 30 or lower, you're probably fine on this. I mean, obviously you want it as low as you can get it, but again, give yourself a little leeway. You're getting used to this thing. You're probably leaking a little bit. Just tweak your mask, adjust your mask, and you know, that'll even itself out. AHI, that's your apnea hypopnea index. I'm not going to go into all that stuff. It's basically like how many times you stop breathing, kind of the same as your events per hour. AI, that's your apnea index. Central, that's your central apnea index, which central apnea is pretty much your brain just says, hey, stop breathing. But again, these are things that you want to talk to your doctor about. He can explain more about that based on your sleep study. The main thing you're looking at is right up here, events per hour. Keep that events per hour, or not that you have control over it, but you want that, you know, 5 events or lower on that. So, all right. And eventually, I mean, you can just leave this. It's going to eventually default back to the home screen. Or if you want to get out of this screen and go to your home screen, you just hit that right there. Boom. Now you're back at the home screen. So, options. You know, if you're on an auto set, you're really not even going to go into options. The main thing you'll go into options for is going to be a ramp. You can adjust that ramp time. What this means, when the machine first comes on, it's on auto. Which again, you know, just leave all this stuff on auto. Your technician's probably already set this for you. These are comfort features, and most of the time we set this to be as comfortable as possible for you. So ramp time is automatic. So what that means, when the machine kicks on again, or when you turn it on before you go to bed, comes on at a low pressure of only 4 centimeters of water pressure. That's going to be pretty easy to breathe on. Not that we actually set people on for, but you know, you're not asleep yet, so you don't really need pressure, but it does have to be on. So comes on at 4. It's going to give you time to fall asleep, and then it will ramp itself up to whatever your prescribed pressure is. Again, I'll get into the pressures in a little bit, but climate control, just basically want to leave all this on auto, especially here in Colorado. You've got an auto adjusting humidifier, auto adjusting climate line hose. These basically, what they do, they talk to each other and they say, hey, you're giving us too much humidity. Okay, well, let's take some of that moisture out, or let's, you know, dry it out a little bit so there's no water buildup in here. This is like, wow, it's too hot of the air. It's very complicated to explain, but basically you've got humidity based on how you're breathing at night. It regulates the temperatures and does all that stuff automatic. You can go in and change this to manual. I do not recommend that because you open up a whole nother can of worms as far as water in your hose, and oh, I'm not using any water, I'm burning through too much. It's a mess. So smart start, that just means when you put this thing on, when you put your mask on before bed, it's automatically going to just kick on because it detects your breathing, comes on automatic. So mask, you have 3 options. You can use nasal pillows, full face mask, or a nasal mask. The majority of patients we start out with is going to be either a nasal mask or a full mask. Pillows, they actually fit in your nose, which, you know, a lot of people say, oh, they're the smallest, but they're not exactly the most comfortable. So anyway, that's that. Mask fit. If you're getting that frowny face on your leak, you know, back on the first screen, right here, if you got your mask seal, if you got a red frown there quite often, you might want to go into your options, go down to run mask fit, put your mask on, click that. I'm not going to do it right now. Well, I'll go ahead and show you. And it'll tell you if you got a good fit or not. And I turn it off, catch it real quick. But it's going to blow pressure while you got your mask on and see if it's sealed. And as long as you have a big, you saw it flash up there, but as long as it's a red or a green smiley, good seal. Warm up, you can actually click that and warm up your water before you go to bed if you want. Airplane mode, so you don't want to mess with this because this actually turns off your modem that's built into this thing. Your provider probably needs that modem to download your compliance data for insurance. Also will allow them to make any changes to the machine that your doc may prescribe. You don't even have to go into the office. So the therapist can get online, log in, boom, change your machine. So be nice to your therapist. But no, they should call you and let you know that they're doing all that. So you notice that little blue light flash and blue little snowflake. So when the machine, because I turned it on and I turned it off real quick. So anytime the machine cycles on and then it shuts off. So like when you turn it off in the morning, it goes into a cool down mode to where it just blows a little bit of air through the machine just to kind of dry it out, keeps it fresh. That will run for another 30 minutes after you shut the machine off, just to kind of keep it clean, dry everything out. So anyway, let's go back to the home screen. And what else? Oh, so over on the side here, you've got this door with the little holes in it. That's where your filter is. So if there's a little notch, you can stick your finger in if you want. Pop the door open. There's your filter. Pop that guy out once a week. Again, more often is not going to hurt anything, but at least once a week, take that out. Just kind of kick the dust off of it. Dust off works great. That's a little cheat. You can just blow these things out and stick them back in. I know most instructions say to wash these things, which technically, that's what you're supposed to do, but, blow them out, get the dust off, stick them right back in. Doesn't have a right or wrong side to it. You just lay it back in there and snap it shut. And these should be replaced. I think they're they vary. Different people say different things. Some people say every 2 weeks, every month. I think manufacturers like every month change those out. But yeah, you can get those from your provider or online. You can get a lot of this stuff online too. Up here, so they used to put little SD cards in them. Ours don't even ship with that anymore because we don't ever use them. We just do the Wi-Fi connection. Not Wi-Fi, but it does not use your internet or anything. It's cell towers is what it uses. So that's how we can log in and do all that stuff. So that's pretty much it on the machine. So let me talk about the mask here for a minute. Okay, so there are hundreds of masks, CPAP masks out there. There's basically 3 types. There is a full face mask, which covers your whole nose, mouth, everything. Like that. That's a full face mask. Your typical Darth Vader, cover the nose, cover the mouth, all that. If you breathe through your mouth all the time, you're probably going to need a full face mask. So again, just talk to your clinician about that. But a lot of people can get away with just the nose mask, which that's what this one is. Just a nose mask is going to cover just your nose, like this guy. So this is one of my favorite masks, and that's what I'm going to show you guys. If you start breathing through your mouth, you will know it. Usually you've got 30 days to exchange that mask. So if you start on a nose mask and it's not working, then call up your provider, say, hey, this just isn't working for me. Make sure it's within those 30 days. because after 30 days, you're stuck. So you have to get used to it. But you can always trade it out and get a full face mask if you need. The third type of mask is nasal pillows. And again, those are, you know, they're small. They're tiny. A lot of people are like, oh, that's what I want. You know, they fit right in your nose. But they're not the most comfortable. So anyway, that, you know, again, it's just my experience with what patients have complained about and stuff. They start out thinking, oh, that's exactly what I want because it's the smallest thing ever. But yeah, not very comfortable. So it's an option. You know, it's an option. And they're usually all the same price, so it doesn't matter. But yeah, this mask right here, usually if we're gonna, you know, if we're mailing out a CPAP or something, we have to do something remotely. This is a good mask to start with because see how happy he is? You know, he's a happy guy. He's getting some sleep, and his wife's happy because she's not awake listening to him snore. But anyway, this comes with 3 different size cushions. So, you know, if we're doing this remotely, this is a good mask because you've got options. You know, yeah, I do like the nose mask, but this little mask doesn't fit me, so then we have to send out something else. Again, this comes with 3 different sizes, so play around with them. See what size fits you best. It actually, I got one open here. So it comes with a large, which has got the L on the bottom of the cushion, L. So that's your large cushion. It comes with a small cushion. So actually that's small / medium, which that's pretty tiny. You know, we don't use a whole lot of those. Most people fit the large, but it also will come with an extra large. And this is basically, it's the same size as the large this way, but it's wider. So it gives you a little more room if you have a wider nose. This may be better for you. So, but again, that's it's preference. So whatever's comfortable on you, figure it out, and go from there. So on the hose, or I'm sorry, on the mask, you've got, oh, don't fall. So you've got this extra little white hose. This is great because what it does, you can pop it off the mask like that. If you just pinch those clips, pops in and out the front, the hole right there. Just kind of snap it in, snap it out. So that's nice because if you get up, go to the bathroom during the night, you don't have to take the whole mask off your head. You just pop that off and, you know, scare the dog or whatever. But get back in bed, pop this back in. So this end of the white hose, so this hose only works on this mask. This hose doesn't fit on any other mask. But your CPAP hose, sorry, get my fat fingers in there. Your CPAP hose, this end of the hose will fit any CPAP mask. So there's how we're going to connect it to that mask. So this is a universal connection. Every CPAP mask has got a connection this size. Well, most, probably 99.9% of them do. And that's going to fit, see if I can do this one hand. Your hose. Good. Yeah, it doesn't work. So your hose is going to go right in there, like that. And just enough to get it in there. You don't have to shove it all the way on. Just make sure it's in there kind of snug. Then you're going to take your mask. I'm going to have to set the phone back down for this, or the camera, so stand by. All right, so getting the mask on. What you're going to do with this is these little clips right here. Most of them now have magnets, so that's just a little magnet, pops on and off. And what you're going to do with this, you undo one side, you can undo both sides actually. And then you're going to put the cushion on your nose. Come on. and then just pull it over and hook it there, and take the other side, hook it there, like that. Yeah. Anyway, you get the idea. Just kind of hook them on. These straps come up over your ears. Then you got a strap on top of the head. Now, you want to close your mouth and breathe. So once you start breathing on this thing, it comes on automatic. And listen to my voice now. You can roll this knob to light it up, because the lights do dim off and shut off automatic. So, but right now I'm only getting a pressure of 4. It will adjust up as I fall asleep and need more pressure. So when you wake up in the morning, you want to shut it off. You're going to come right there. Actually, you can take the mask off and it'll shut off. Well, no, easier, hit the button. Shuts it off, and then you can take the mask off, and then I'll show you what all this is. So, okay, so we shut the machine off, wore it for a complete 1 minute last night. Nice job. You had 0 events per hour. Nice job. My mask seal was good. Nice job. You know, you get the idea. Anyway, again, remember, I shut it off, so now it's in that cool down mode, so it's blowing air through. Eventually, like I said, it will go back to the home screen, which is your default screen, and that's it. I mean, you've worn it all night. Good job. And you're ready for the day. So you can take your mask off and, you know, store it somewhere, like on your dirty table in your office. Yeah, that's pretty much it with actually using the machine. You know, if you got any questions, feel free to put them in the comments. We'll see what we can answer. Oh, let's talk about the pressures for a minute. So your doctor, based on your sleep study that you had done, your doctor would have sent over a prescription for us to set a CPAP machine on a certain pressure, or an APAP machine, or auto PAP, or normally we call everything CPAP. But what that means is when if you did an in-lab test where you actually went into the sleep study, what they determined is you went to bed with no mask on or anything like that. This is called a split night study. You went to bed, no mask on. They came in, they woke you up at, you know, whatever time, said, you stop breathing, we got to put this mask on you. What they're doing is they're getting you onto CPAP. So they put this mask on you, they get you back to sleep, ideally. And then what they do is they titrate you to a certain pressure. That pressure that they titrate you to is what was most effective at maintaining that airway, at keeping that airway open, keeping you from having these events at nighttime, apnea events. I say a lot, so sorry. But that's why the doctor actually prescribes that pressure to you. Now, if a lot of patients nowadays, they do the studies in home, where it just says, yeah, this patient has sleep apnea. So the doctor looks at it and says, okay, we want to start this patient on an auto PAP or an APAP, or auto adjusting CPAP or whatever. But what they usually do is they'll send over a prescription for a range of pressure. So what that means, when you first put the mask on, it'll usually start out really, really easy, you know, like I said, on that low pressure, get you to sleep. Then you've got a range of pressures. Most of our docs are writing like pressures of 6 to 16, which is pretty fair, because once you fall asleep, then your pressure is going to go up to 6. Well, you're asleep, who cares? You know, let it do what it needs to do. And at that pressure of 6, it's maintaining your airway. Well, now say your airway has an event, you know, it starts to collapse in on that pressure of 6. Well, the machine's going to go, no, 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 no. We're bumping you up. We'll give you 7 or 8 or 9 or 10 or 16, you know, whatever it takes to keep that airway open. So it will auto adjust. And again, you're sleeping, so who cares? Let it do its thing. But if you wake up during one of these events, which is very common when you're getting used to this thing, because now you've got this blast of air coming at you, 2 in the morning, and you get very frustrated. You're suffocating. You can't breathe. Very, very common. We hear that all the time. I'm suffocating. I can't breathe. Truth is, with these things, you can't not breathe because it's pushing air. It's giving you air. But it's hard to breathe out against it. Well, that's the positive pressure. That's what CPAP is, continuous positive airway pressure. So that's that pressure coming in. It's normal. You got to get used to it. Don't know how else to say it. Suck it up. You got to do it. It's not the easiest. Take your time, relax, and breathe. But what I was going to say is if you wake up and you feel a large blast of air coming at you, and this is just with these specific AirSense machines, the way we have them set up. If you reach over, you just turn it off, you know, roll over and go back to sleep. You're still breathing, so it's going to trigger that machine to kick back on. When it kicks back on, or if you want to just reach over and turn it off, turn it back on, you can turn it on. That's going to give you, it goes back down to that low pressure. It's basically like a reset. That on-off button on top is like a reset. You know, shut it off, turn it back on, and it will reset back to that low pressure of 4. So it'll allow you to kind of get back to sleep, drift back off, and it's going to go up and start doing its thing again once you get back to sleep. But that's CPAP. You got to get used to it. You've got to do it. You've got to do it. A lot of these docs will send you in here. They discovered you have CPAP because you've got other issues. You've got blood pressure issues. That's very, very common with sleep apnea. High blood pressure because you're putting more strain on your heart as you're sleeping at night. So you got blood pressure issues. You're overweight. That's another issue. You can be pre-diabetic. Many different issues. Again, these are things you want to talk to your doctor about. But a lot of that is fixed with just wearing a mask. So wearing a mask and having air blown at your face all night. Not the most ideal thing to do, but it works. It works. It works. Give it a chance. There's tons of people out there that have said this thing is just not for me. I can't do it. You know, some people can't. Some people you just can't do it. If you're anxious, people get panic attacks wearing these things, and that's normal. It happens. Talk to your doctor about these things. Because some docs, they will help you. They'll prescribe you something that will, allow you to relax at night because, hey, I'm getting used to this CPAP. They'll give you things that'll help you relax, and maybe that's all you need, or maybe you just aren't going to do it. You just can't do it. I highly suggest you suck it up and get used to it. But if you can't, talk to your doctor. A lot of docs are going to refer you back to us, and honestly, as long as I've done this, I mean, if you're not willing to do it, you're not going to do it. So you have to be willing. You have to do it. Again, no, it's not fun. Yeah, you're going to get little marks on your nose sometimes. Not all the time. Sometimes you might. You can't. Now, actually, speaking of the marks on the nose, don't ignore them. I mean, if you get like little zits or something, as I've had patients describe it as a little zit or something shows up, what you can do, you're not having an allergic reaction. You're not. 9 times out of 10, you're not. Anyways. So yeah, the marks on your nose, not necessarily an allergic reaction. A lot of times it's just friction. The mask is moving around on you. Easy way to fix that is if you go to the grocery store or Walgreens or somewhere like that sells moleskin. It's usually in the Band-Aid section, and it's just moleskin, moleskin. They come in little sheets, little square sheets, and you can cut off little strips and actually put those on your face before you put the mask on, strictly use moleskin. Don't use Band-Aids, stuff like that, because it'll peel as you're pulling it off in the morning. It's just not, it doesn't create a good seal for the mask either. A Band-Aid does not, because they're slick. The moleskin has a little bit of a grip to it, so it'll actually sometimes help prevent leaks if you put a little moleskin on your skin, then put the mask on. And again, that's going to keep it from leaking. It'll keep the marks, on your nose from happening, if they're happening, pretty badly. But that's kind of a last resort. You are going to get a little redness every now and then just from having the mask on all night long. Should go away after, first, second cup of coffee. So so that's a mask. A lot of leaks that you get with the mask, an easy way to fix those leaks, and normally they're going to be like right up in here where they shoot in your eye, and it just really annoys you all night long. If you're getting those type of leaks, don't start cranking the mask tighter and tighter, because when you do that, a lot of times that can actually create more leaks. All you need to do, grab the mask, pull it out, kind of reseal it, reseat it on your face. 9 times out of 10, that's all you need to do. Again, not too in depth with the mask, because there's tons of videos on YouTube that'll show you mask fitting and things like that. Just whatever mask you're looking at, Google it, look it up on YouTube. You'll find a gajillion different videos on those masks. So anyway, I think that about covers it. I'll go back through this as I'm piecing all my videos together and see if I missed anything. But anyway, yeah, like I said before, questions, comments, anything, drop them down there, and we'll see what we can do. So anyway, thanks a lot.